living through interesting times right now in the world, and while all our thoughts are on COVID-19, we're still trying to live a normal life. So are those living on hospice care. And today's CI Health sponsor is Transitions Hospice. Jessica Lyles, the Regional Hospice and Palliative Coordinator, is here. Welcome.
Thank you.
Okay, so a lot of patients feeling isolated from the outside, and a lot of people are feeling isolated inside. Let's talk a little bit about the services that you provide with hospice care.
So we are a hospice and palliative care company. We take care of patients in the home, and that could be an assortment of different places. So your residential address, assisted living, independent living, memory care, or a skilled care facility. We offer nursing support. We offer CNAs, nurses, licensed and registered, and we do a lot of different things to make sure that hospice patients are taken care of. Especially in a time like this, you really want as many people on your care team as you possibly can. So we're going to patients' homes, to the facilities that they're currently living in, and we're helping them with end-of-life care.
And I'm sure you are taking all of the necessary precautions for your staff to make sure that they're staying safe and healthy, as well as for the patients that they're caring for. I think there's a lot of misconceptions when you hear the word hospice that it's a negative thing in, end-of-life times. But really, it is positive for the person you're caring for.
100%. So, like you stated, we are definitely taking precautions with the CDC and keeping within their guidelines. But even more than that, we're trying to make sure that we're giving people a spirit of hope in this time, because even though it is very trying, we are providing all of that support to them in their homes. With the hospice connotation, it's definitely a stigma that I would like to remove, but it's something that once you understand, it's really more about support than it is end of life. We're trying to make sure that while, yes, this person is being seen for a terminal diagnosis, that they're also being seen with dignity and care in this time.
Yeah, it's all about quality over quantity.
Yes, 100%.
Let's talk a little bit about when someone should make the call to your organization to get those services.
So there are a lot of different reasons that someone would call. One, if you just have simple questions. So a lot of times people have a really good relationship with their primary care physician. It might be referred from their doctor that hospice is appropriate. It also might just be something that the patient internally knows that they need to be preparing for that conversation, or a family member might have mentioned it to them. So it's better to ask in the beginning. It might not be the right time, but we can help you decipher when would be the right time.
And speaking of time, are you 24/7 or 9 to 5? How does that work?
24 hours a day, 7 days a week, for phone calls, for assessments, for consults to meet with myself or another regional hospice coordinator. But we provide routine support for the nurses that are on our hospice as a patient. We're not 24-hour care in the home, but we are 24-hour support if you would need us.
Let's talk about what a consultation looks like. Somebody calls you up, they have questions, you recommend them coming in for a consultation. How does that visit look?
It looks just like this, just a conversation between two people. You would meet with myself, or there's two others that are on my team, and we sit down with you wherever you choose and go over some paperwork and some general questions.
Yeah, and it's wonderful to know that you're providing that family and the patient, quality of life there in the end, and the dignity that they deserve during this time. So if people have questions and they want to learn more and they want to set up that consult, what's the best way for them to do that?
You can check out our website. It's www.transitionshospice.com, and it'll give you all the information that you need.
All right, Jessica, thank you so much.
You're welcome.
If you need any more information, there's a look at the Transitions Hospice website, which we will connect you with at ciLiving.tv.